I hope you're fine. I'm also in good condition. Today, the topic is very interesting and is related to one of the dental emergency, and that is tooth avulsion. Avulsion is basically total removal of the tooth from its socket due to any fall, any injury, might be sports injury or any quarrel between the persons. Usually the teeth involved are front teeth. Front teeth are usually visible, more visible in the mouth. Front anterior teeth, maxillary incisor especially are more prone to tooth avulsion. So what should you do and what dentists do in this condition? While you are at home, if you think you can replant or refix the tooth, the first step is always hold the tooth from its crown portion, this crown portion, the upper portion which is visible in the oral cavity. Never hold it from the root portion, as there are specialized cells called as periodontal ligament cells on the root surfaces which help in reattachment of the tooth with the alveolar bone structure. So always preserve these cells. These are very important for binding of the tooth with the jawbone. After holding the tooth with the crown, the second step is gentle rinsing of the tooth under the tap water. Third step is gently fixing the tooth in the jawbone. And fourth step is put a handkerchief or any cotton roll over the tooth and bite the teeth together so that the tooth will stay in the mouth. If you think you are unable to refix or replant the tooth in the jawbone by yourself, put it in some storage media. There are specialized media available for this purpose, like Hank's balance salt solution, but the common available in every home is cold milk. You can put the tooth in the cold milk jar or bowl and then carry it to the dentist. As early as possible is important for good prognosis of the tooth. The upper limit is 60 minutes, but it's best to replant or refix the tooth as early as possible. When you go to the dentist first examine your face, any injury on lip area, cheek area, gums area, or bony fracture, any fracture to jaw area, and any open wound in the body. So the first step is tetanus vaccination. Second step is suturing of any laceration involving the soft tissue around the teeth. And third is replant the tooth in the jawbone. After replanting the tooth, the dentist apply a special wire with a bonded material called a splint. Usually the splint uses flexible so that it will hold the tooth in its position for 15 days. During this period, the cells over the root, that is periodontal ligament cells, reattach the tooth with the jawbone, and that is our objective. So it's very important to reimplant or refix the tooth as early as possible. After supplanting, the dentist will observe the tooth. If there is any sign of infection, any abscess, or any discoloration of the tooth, then the dentist will go for root canal treatment of that particular tooth. And very important thing in this is timely management of the tooth. If you replant the tooth during 5 to 15 minutes, that is the best time to replant and the prognosis will be good. Many patients ask us that their children milky tooth or teeth avulsed sometimes. Then what should they do of the milky teeth, also called as deciduous teeth? The deciduous teeth must not be refixed in the jawbone, must not be replanted. They are contraindicated to replant, as in the jawbone there is bud of the permanent tooth. If we try to replant or refix the milky tooth in the jawbone, then there is chance of damage to the permanent tooth bud that is more dangerous. So ideally, we never replant the deciduous or milky tooth in its position. We wait for permanent tooth eruption in this case. So always try to save your tooth. A very important and common example in many hospitals where students are learning and extracting the tooth. Sometimes they extract the wrong tooth. In this case, if they know that they did a mistake, they can replant that particular tooth in its own socket. The attachment will be very favorable and the prognosis will be very good. So in this case also we can replant the tooth, same as in the case of avulsion, as the whole tooth is out of the socket. So this video will be helpful to you. The main key points are: always replant or refix the tooth as early as possible. Number two, the storage media easily available in every home is cold milk. And number three, always visit your dentist as early as possible. Hopefully, this video will be informative to you. If any question related to this, you can ask in the comment box. And also like, share and subscribe my channel so that further information will be delivered to you. Thank you.